day, Mom. I'm Abby, your student nurse for today. May I know your name, Mom?
Maurice Sineres.
Okay, Miss Maurice, today I'm going to do an assessment of your head down to your tooth. So may I start, Mom?
Yes.
Okay, so first I'm going to close the door for our privacy. Now I'm washing my hands to avoid any spreading of contamination. So are you comfortable in your position, Mom?
Yes.
Okay, so let's move on and proceed to our assessment. So I'm going to start up and by asking you a few questions. So may I know your full name, Mom?
Maurice P. Sineres.
How about your birth of date?
March 1, 2011.
So do you know where you at now?
At the hospital.
Okay, so do you have any idea what are we going to do today?
We're going to head to toe assessment.
Okay, so how about the President of the Philippines?
President Rodrigo Duterte.
Okay, so I observed that you are alert and oriented. Now, I'm going to collect your vital signs, your blood pressure, your temperature, your oxygen saturation, your pain ratio, and I will also collect your height and weight and solve for your BMI. So, I'm going to start now. Okay, so your blood pressure is normal. Next, let's check for your temperature. And I can see your oxygen level is up to normal. Okay, it's 36.7 and that is the normal temperature. Now, I'm going to ask you, do you have any pain feeling right now? 0 for none at all and 10 for reverse pain.
0.
Okay, that's good. Now, I'm going to proceed to check your weight and height. Can you stand up for a second, Mom? Then you go there, okay? Okay, that's good. Now let's go on and check your height. Can you go on that corners? Okay, that's good. Okay, so I'll document everything. Now I'm going to check for your head and see if I can see any abnormalities like drooping or twitching that may indicate Bell's palsy or stroke. I can see anything abnormal, and I can also see that your size of head is appropriate for size of person. And I can see that your head and that your ears and eyes are on the same level. That's good. I don't see any discoloration. And okay, that's good. Now I'm going to palpitate your head to see if I can feel any lumps, manifestation. any abnormalities. And I can see none. Now I'm going to check for the cranial nerve number 7. Can you open your mouth for me, ma'am? Now close it. I can see if I can feel any clicking, and I can see none. Now let's check for your cranial nerve number 7 or the facial nerve. Can you close your eyes tightly for me, ma'am? Okay, now open it. How about, can you smile for me, ma'am? How about frown? Pop up your cheeks. Okay, that's good. I can see that you did it with ease. So that means your cranial is intact. Now, I'm going to palpitate your cyanosis. So tell me if you feel any pain. So I'm going to start up by palpating it here in maxillary. So I'm going to palpate it now. So do you feel any pain, mom?
No.
Okay, that's good. Now I'm going to proceed here in the temporal. Do you feel any pain?
No.
Okay, so everything is normal. So I'm going to proceed to your eyes. What I'm looking for, if I can see any abnormalities, I'm going to check your sclera, your pupil, and your iris. The sclera is the white of your eyes, and I don't see any discoloration like jaundice for yellow. I'm going to check your sclera, which is the white of your eyes, the pupil, and your iris. So, when looking at your eyes, I don't see anything abnormal, like discoloration that may indicate yellow for jaundice, blue for cyanosis, and red for erythema. I don't also see anything abnormal in your conjunctiva. I don't see any swelling, and I see that you don't have any I don't see any abnormalities like strabismus or cross-eyed or anisocoria, which one of your pupil is smaller than the other. So let's go and proceed to test your cranial nerve. So we're going to undergo some tests to test its function and see if there's any abnormalities like involuntary shaking or movements of your eyes. So first, the cranial nerve is the cranial nerve number 3, which is the oculomotor, cranial nerve number 5, which is the trabecular, and cranial nerve number 6, which is the optics. So I'm going to use the pen light to test its function. So ma'am, I'm going to place this pen light in 12 to 14 centimeters away from your nose, and I want you to look for it while not moving your head. I'm going to move it in a 6 cardinal ways, and I want you to follow it as I move it without moving your head. Okay, thank you, very good. I don't see any involuntary movements. Now let's proceed checking if your pupils will constrict. So, mom, can you look at the wall behind my back? So I'm going to shine a light in your eyes to see if your pupils will constrict. So can you look at the wall behind my back? Okay, so it's constrict. Now I'm going to do the same in the other eye. So it also constrict. So now I'm going to check if your pupils will dilate. Can you look at the wall behind my back again, mom? Okay, thank you. Now I'm going to move this pen light near your nose to see if your pupils will dilate. Can you look at the wall behind my back, ma'am? Okay, wall. So I'm going to palpate your nose if I can feel any abnormal, like lesions. Mm-hmm. Any lumps? Do you feel any pain in here, ma'am?
No.
Okay, so I can also see that your nose is in midline. So let's check your airflow of the nose. Can you cover one of your nose, ma'am, and breathe? Mm-hmm. How about the other one? Okay, so I can see that you can breathe properly. So I'm going to check in the inside of your nose to see if there's any abnormalities like polyps. So I don't see any abnormalities, and that's good. Now let's check your cranial nerve number 11, or your olfactory nerve. So can you close your eyes, ma'am? So I'm going to put something near your nose, and I want you to identify what is it. So close your eyes. So can you tell me what is this, ma'am?
Perfume.
Okay, so you identify it correctly. You can now open your eyes. So you identify it with ease, and that means that your olfactory nerve is intact. Now let's proceed assessing your mouth. So I observe that your lips is pink and dry. I don't see any lesions or any discoloration like bluishness that may indicate cyanosis. So can you open your mouth for me, ma'am? Okay, so I'm going to check the inside of your mouth. Say ah. Can you open your mouth for me, ma'am? Okay. So now I'm going to okay, so now let's check your cranial nerve number 10, or your glossopharyngeal. So can you stick out your tongue for me, ma'am, and move it side by side? So I can see that you done it with ease. So that means your cranial nerve number 12 is intact. Now I'm going to check the inside of your mouth. I don't see any lesions. Your cheeks is pink. I don't see any abnormalities like dental caries, tonsil exudates, or thrush. And I can also see that your uvula is in the midline. So, can you stick out your tongue, ma'am? Can also see that your tongue is pink and moist. So, can you lift up your tongue for me, ma'am? I don't see any lesions. Now I'm going to check for your cranial nerve number 9, or the glossopharyngeal. Can you open your mouth for me, ma'am? So I'm going to put inside. Okay, there you go. So next is I'm going to check your cranial nerve number 10, or the vagus nerve. And I observe that your vagus nerve is intact since you can talk properly without hoarseness, and you can swallow properly. Now we're going to proceed to your ears. So I'm going to palpate your ears to see if there's any abnormalities like tenderness, nodules, infestations, lumps. So do you feel any pain, ma'am?
No.
Okay, so that's good. Now let's check inside of your ears. I'm going to use this otoscope to see inside. I can see that the tympanic membrane is grayish and pearly, translucent. That is normal. But the other one. Okay, so everything's inside is normal. Now I'm going to check your cranial nerve number 8, which is the vestibulocochlear. I'm going to cover one of your ears and whisper to your opposite ears, and I want you to repeat everything that I say. Is it okay with you, ma'am? Okay, so I want you to repeat what I whispered.
Apple pie.
Okay, the other one.
Boko pie.
Okay, so I observe that you did it with ease. So that means that the cranial nerve is intact. Now, next, we're going to check your neck. So I'm going to extend your neck to see your trachea. So I see that your trachea is in the midline. I don't see any lesion, lumps, or any thyroid problems like goiter or something like that. Okay, so now um, now we're going to test for your cranial nerve number 12 or accessory nerve. So can you move your neck left and right, mom? Okay. How about up and down? So can you shrug your shoulders with my disease? Okay. I see that you does it with ease. So that means your cranial nerve is intact. Now I'm going to palpate your trachea to see that it is in the midline. So, yes, so it's in the midline. Next, we're going to palpate the lymph nodes. So normally we can feel the lymph nodes. So if we feel the lymph nodes, that would be a concern. So we're going to start here in a pre-auricular, which is in front of the ear. Next is the post-auricular in the back of the ear, the occipital, the jugulogastric, submandibular, submental, cervical. So next we're going to do is to palpate your lymph nodes. So starting here in the pre-auricular or in the front of your ear. Next is in the post-auricular or the back of your ear. The occipital, the jugulogastric, the submandibular, submental, your superficial cervical, your deep cervical chain. So do you feel any pain so far, mom?
No.
Okay, that's good. And lastly is your supraclavicular. So as we expected, we don't feel any lymph nodes. So that means we have no problem in your cranial nerve. Check your arms to see anything abnormal, like herpedins or Bouchard's nodes. And I don't see any of it here, so that's good. Now I'm going to move your arms up and down. So it moves gently, so I don't see any problem with that. Now, can you stand up, mom, for a second? Now, can you move your arms forward and close your eyes? I'm going to observe you for more like 20 seconds to see if your arms are going to drift like that, because driftings can sometimes be caused of stroke. So that's good. Okay, now okay, you're gonna relax your arms. I don't so I observe it don't drift, so I don't see anything of concern. Sit down first, ma'am. Since you're wearing clothes, so you don't have to undress. Now I'm going to check for your heart sound. I'm going to auscultate it from um, aortic, pulmonic, earth point, tricuspid, mitral valve, and for apical pulse. So first, I'm going to auscultate it using the front of the stethoscope, then next for its belly. So here first, na your teeth. Okay. Next, I'm going to do it again, but this time I'm going to use the belly of the stethoscope. So first here, na your teeth. Pulmoni. Okay, so I didn't hear anything abnormal. Now, like wheezes or crackles. Now, let's proceed for checking for your lungs. So, I'm going to check it from upper clavicular downward. Okay. Can you breathe deeply, mom? Deeper, please. Okay, next. Again. 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 Okay, that's good. So I don't hear any abnormal and anything of concern. Now let's go and move on. Proceed to checking your extremities, the upper and lower extremities. So first, let's do the upper extremities. So while inspecting your skin and arm, I don't see any abnormalities and discoloration that may indicate some problem, like cyanosis, that would be blue, jaundice, that would be yellow, and red for erythema. So I don't see anything, and that is good. Now let's go and proceed checking your racial pulse. I can see that, I can feel the two pulse and they beat bilaterally. Okay, that's good. Now I'm going to check for your um, nail refill. I'm going to palpate here in your nail bed and see that I can see that the nail bed goes back within 2 seconds. Now I'm going to pinch you right here to check your skin turgor mobility. I see that your skin is flexible, it moves back easily. So that means it is normal. Uh, Lay down properly, mom. Okay, so do you have any problem with your abdomen, mom?
No.
Okay, that's good. So I don't see any lesions, any lumps, wounds, or anything like that. I don't see any discoloration that may sometimes indicate cyanosis, that would be blue, jaundice, that would be yellow, and red for erythema. So I also see that your umbilicus is in the midline, and that's good. So next we're going to auscultate and hear your vowel sound, starting here in your right lower quadrant and do it clockwise. So we're going to listen for about 45 minutes and see if it's hypo or hyperactive or normal. So we're going to start now in the right lower quadrant. so everything sounds good. Now let's move on and check for your vascular sound using the bell of the stethoscope. So can you lay down properly again, mom? Okay, so I'm going to auscultate again. Okay, so everything sounds good. Now let's move on. I'm going to light and deep palpitate your abdomen to see if I can see anything abnormal like masses, rigidity, tenderness. So I'm going to do the light palpitation now. So tell me if you feel any pain, okay, mom? Do you feel any pain?
No.
So just tell me if you feel okay. So do you feel any pain so far?
No.
Okay, that's good. Now I'm going to proceed and do the palpation. So tell me if it hurts, okay? Okay, so I didn't feel anything abnormal or anything of concern. So everything overall here in I don't see anything problem here in the upper extremities. Okay, so can you lay down properly, ma'am? Okay, so let's proceed to your lower extremities. So checking your lower extremities, I can see that your feet is warm and dry. I don't see any discoloration. I don't see any here in your joints. I don't see any redness or swelling. And I don't see anything abnormal here in your feet like gout, toothless cracking, or ulcer. Feet. Now I'm going to check for your uh, to refill. I'm going to pinch right here to see how long it will take or how fast it will move back. And it moves back easily, and that's good. Now I'm going to check for your reflex. So this may be ticklish. And I can see that you bend your toes, and that's normal. Now can you raise your uh, feet with my resistance? That's good. So everything is normal. So can you stand up for a second, mom, so that I can check your back? Stand up, stand up. Okay, so I'm going to raise your clothes. So what I'm looking for, if I can see anything abnormal like moles that is as big as the eraser of the pencil, that may indicate melanoma or any skin cancer. So I don't see any abnormal. I also don't see any discolorations. So that's good. I don't see anything of concern. So okay, let me help you for that. So let me now sit down. Do you so that wraps up our assessment from your head down to your tooth. Do you have any question, mom?
No. Thank you.
Okay, so I'm going to document everything that we do, and that wraps up everything, and thank you for your cooperation.